Good evening, everyone. Thanks for joining us. 15 years ago, deer ticks were a rare sight in most of the Lakeland viewing area. Now they have spread north and incidents of Lyme disease are higher than ever. Becky Parker explains what could be causing the growth and how treating the disease can be a challenge.
Lyme disease is a growing problem in northern Minnesota, but some aspects of Lyme are still a mystery. 2010 saw the highest number of Lyme disease cases ever in the state, and trends show the deer ticks that carry the disease are moving north.
Going back a decade or so at where people were most often getting Lyme disease, it was farther south in Minnesota, closer to the cities and more over toward Duluth. And now the highest risk areas do include southern Beltrami County.
Bemidji State University professor Patrick Guilfoyle has been studying these ticks for more than a decade. In that time, he's seen the deer tick population in the northern part of the state grow dramatically. Mild winters and the abundance of deer and mice are factors that affect the deer tick population.
And it may well be that those factors work together, that a milder winter means better deer survival, may mean better mouse survival, and all of those could contribute to higher numbers of ticks.
The Minnesota Department of Health has speculated that with this year's very mild winter, the number of Lyme disease cases could rise. About 1 in 5 deer ticks carries the Lyme disease pathogen, but here in the North Woods, the prevalence of that has also grown. For those who contract the disease, finding the right treatment plan can be challenging. The Brainerd Lakes chapter of the Minnesota Lyme Association held a seminar in Pequot Lakes, which tackled the issue of how Lyme disease patients can communicate with their doctors for better care.
The standard approaches work for many people, in fact, for the majority. But for the sizable number of people who don't get well after standard treatment, that's when there has almost become this impasse as to what should be done for those patients.
Early detection of Lyme disease is critical to chances of overcoming it. Experts advise people wear repellent and check for ticks when going into wooded areas. Becky Parker, Lakeland News.
May and June are the peak months to contract Lyme disease, so watch for small poppy seed-sized ticks.
If you've enjoyed this segment of Lakeland News, please consider making a tax-deductible contribution to Lakeland Public Television.